Welcome to part 2 of our ED Facility Coding Explainer series. Today, we're taking the ACEP guidelines and looking at them in a completely different way. We're going to treat this whole thing like a video game to help you really master the rules. If you've ever played a game where you collect points to reach the next tier, well, you already have the exact mindset you need for what we're about to do.
Let's step right into the emergency department. Our main goal today is to learn exactly how you score points to level up a patient's visit. We want to see what takes it from a basic level 1 all the way up to a maxed out level 5. And remember, we're doing this based strictly on the facility rules, which are all about tracking the actual physical resources used during that patient's stay.
Let's take a quick look at today's game plan. We'll start with resource consumption, map out our 3-column matrix, learn the ultimate golden rule, and then walk through the actual points you need for levels 1 through 5.
All right, Section 1, the core principle. Whose resources are we actually counting?
Before we even look at the matrix, we have to understand a fundamental CMS rule that makes facility coding completely different from professional coding. Honestly, this is the foundation of the whole game. CMS recognizes that the EM level reported by the hospital is totally separate from the level reported by the physician. Why? Because facility coding focuses 100% on facility resource consumption. We're scoring things like nursing time, room use, supplies, and equipment. The physician's mental work, their medical decision-making, that doesn't score you any points here. We only score the hospital's physical overhead and the staff's effort.
Okay, Section 2, the 3-column matrix, also known as your game board.
To help us track all that staff effort, ACEP built a specific framework, and you can think of this matrix like your game interface. Column 1, over on the far left, shows your final level and APC score. For a Type A emergency department, those are your 99281 through 99285 codes, and for Type B, they're the G0380 through G0384 codes. Then you've got Column 2 right in the middle. This lists the actual staff interventions. Think of these as your action points. And finally, Column 3 on the right lists potential symptoms, just to give you some context.
Moving into Section 3, the golden rule. Seriously, if you want to know how to score points and actually win this game,
you have to memorize this one rule. Your level assignment is based entirely on Column 2. That's it. You only score points for the actual nursing and staff interventions that happened. This means you must treat Column 3's symptoms as a total distraction. Ignore them. The guidelines explicitly state that the right column of potential symptoms is just an aid. It does not dictate your final level. Like, if a patient comes in complaining of severe chest pain, but then they refuse all treatment and leave after a basic chat with a nurse, you do not get to code a level 5 just because chest pain sounds scary. You score the interventions, not the symptoms.
And that brings us to the ultimate cheat code of the game, the highest intervention rule. When you're looking at Column 2, a single high-level intervention automatically elevates the entire visit level. Say your patient has 5 different level 2 interventions, but the nurse also performs just one level 5 intervention. Boom, the entire visit instantly levels up to a 5. The highest single action always sets your final score.
So let's look at Section 4, Levels 1 and 2, the basics. Let's start at the bottom of the board. Think of Level 1 as the tutorial stage. A patient walks in with a minor insect bite, maybe they need a quick prescription refill or just a simple work note. The nursing staff does a basic initial assessment, and the patient is in and out quickly. Very few resources are consumed here, which gets you those 99281 or G0380 codes.
Now we step up to Level 2, when the nursing staff has to get a bit more hands-on. Yeah, so we level up to 2 when they're spending slightly more time and using a few basic supplies. Imagine a patient who needs basic bedside testing. The nurse collects a clean catch urine sample, maybe does a finger stick glucose test, or applies a simple sling. Checking visual acuity or just getting a tray ready for a simple procedure, that also falls right into this 99282 or G0381 bucket.
All right, Section 5, maxing out, levels 3 to 5. This is where we start racking up the big points. Level 3 is where the intensity really ramps up. The sirens are wailing, your patient just arrived via EMS. Staff resources jump here because maybe a nurse places a saline lock, administers a single nebulizer treatment, inserts a Foley catheter, or stabilizes a C-spine while getting the patient ready for a single X-ray area. Also, administering oral prescription medications, that'll bump you right up to this 99283 tier as well.
Now let's test your logic for a second. Think about the resource jump here. If a nurse has to prep a patient for multiple diagnostic tests, or maybe complex imaging studies instead of just a single X-ray, does that stay a level 3?
Nope, it levels up.
Level 4 captures significant, complex staff work. Now your team is prepping the patient for special imaging, like a CT scan, an MRI, ultrasound, or a VQ scan. You're hooking them up to a cardiac monitor, pushing parenteral meds, so that's IV, IM, or sub-Q routes, placing an NG tube, or doing complex eye or bladder irrigation. Oh, and giving 2 nebulizer treatments, that scores here too. The hospital overhead at this 99284 level is really substantial.
And finally, we reach the absolute maximum score on our matrix. This is level 5, the boss level. We're talking about maximum facility resource consumption, where the hospital staff is completely immersed in patient care. Picture a critical room. The staff is doing frequent multi-vital sign monitoring, prepping the patient for contrast imaging, administering a blood transfusion, or assisting a doctor with an invasive bedside procedure like a central line, providing oxygen via face mask, giving 3 or more nebulizer treatments, moderate sedation, and applying chemical restraints. All of that lives right here. Even assigning a staff member to a one-on-one suicide watch falls into this category. Remember the golden rule. Just one of these high-stakes actions hits the maximum 99285 score.
Okay, Section 6. Let's do a quick recap and talk about next steps so you can win this game every time.
Here's how you do it. Step 1. Always map the staff actions to the ACEP board in column 2. Step 2. Completely ignore the symptoms in column 3. They're a distraction and do not dictate your code. Step 3. Find the absolute highest staff intervention performed because that single action drives your final facility code.
So, you now know how to navigate the board, but what happens when the patient is actually ready to go home? Join us in part 3 of our series where we'll tackle discharge instruction complexity and run through some real-world case scenarios. Missing just one high-level intervention means leaving legitimate hospital revenue on the table. So I leave you with this. Are you scoring all your points, or are you shortchanging your facility? We'll see you in the next explainer to find out.